Hi everyone, this is Neil Wright, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the WAXscope. And I have a couple of procedures here which both involve me removing occluding dead skin. So this is patient 1, and you can see the skin is quite pale. It was quite reflective when I first inserted the WAXscope, so I've reduced the brightness, or what we call the exposure, so we're not getting that reflection. And starting off with microsuction here, I'm just giving this a little wriggle, trying to separate this from the canal walls. With this type of skin, when you use forceps, it's because it's a bit soft, it's more likely you just tear the skin as opposed to extract it. So I'm just going to peel around the edges. I'm just using this rocking motion. You can probably see in the distance the skin is beginning to come away from the deeper part of the canal wall as well. So I'm just looking a bit higher up. This is more to the back, to the top part. I think I've also increased the suction tip size. I was probably using a 16 gauge initially, but I've just gone to the 14 standard gauge, which we also call the Zollner. And you can see this is getting more traction. The skin is beginning to peel at the top. I think, if memory serves me right, this is going to come out in one plug. So there's the first bend to the right. So this is the patient's left ear. Again, I'm just giving it this little circular motion, and as I'm bringing it out, I'm ensuring that I bring the plug out around the bends and twists of the patient's ear canal. So you can see the top left, there's a bit of what we call a tympanosclerotic plaque, so a bit of scar tissue, but it's almost like a plaque. Patient might have had a tear to their eardrum, just to the back part. There's a section there that looked like there's some trauma in the past, but it's healed. So this wax is a bit drier. Now, I'm not sure whether I do use forceps. At the moment, there's nothing really to grab onto. So starting off with suction. There was another one, a video that I was going to include in this compilation, but it was a bit longer, so I decided to leave that behind, and I'll upload that separately. And there, again, it was a dead skin plug that had been pushed in, and I used initially the suction to manipulate the wax in such a way where I can then use the forceps to extract. Now there's a bit at the bottom where it could have reverted to forceps, but I could feel it coming away. So I'm just going to give it a little wriggle, lift it from the base. You can see it's peeling away nicely there. And I'm just going to slowly bring that out of the ear. That's the patient's eardrum. I'm just going to get that in focus. Got a lovely clear view there. And then there's just a bit of dry skin around the edges, so we're just going to suction this away. So I think I might just be changing suction tip, we shall see. I'm just gonna gently lift this off the canal wall. So as we're gliding with the suction tip, we want to ensure that we glide into the midline so we're not grazing the canal. So this is just at the second bend, so it's probably about a centimetre into the ear canal. Just a bit more skin that I'm going to lift away. Got this piece of skin that's stuck to the hair, so I'm just going to leave that. It wasn't coming away. And then that's the patient's eardrum. Well, I hope you enjoyed that quick compilation. Take care, guys. Keep well and speak soon. Bye.